How can you tell if you have diabetes? Most early symptoms are from higher than normal levels of glucose, a kind of sugar, in your blood. The warning signs can be so mild that you don't notice them. That's especially true of type 2 diabetes. Some people don't find out they have it until they get problems from long-term damage caused by the disease. With type 1 diabetes, the symptoms usually happen quickly, in a matter of days or a few weeks. They're much more severe too. Early signs of diabetes. Both types of diabetes have some of the same telltale warning signs: hunger and fatigue. Your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to take in glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin your body makes, the glucose can't get into them and you have no energy. This can make you hungrier and more tired than usual, peeing more often and being thirstier. The average person usually has to pee between 4 and 7 times in 24 hours, but people with diabetes may go a lot more. Why? Normally, your body reabsorbs glucose as it passes through your kidneys. But when diabetes pushes your blood sugar up, your kidneys may not be able to bring it all back in. This causes the body to make more urine, and that takes fluids. The result? You'll have to go more often. You might pee out more too, because you're peeing so much you can get very thirsty. When you drink more, you'll also pee more. Dry mouth and itchy skin. Because your body is using fluids to make pee, there's less moisture for other things. You could get dehydrated and your mouth may feel dry. Dry skin can make you itchy. Blurred vision. Changing fluid levels in your body could make the lenses in your eyes swell up. They change shape and can't focus. Symptoms of type 2 diabetes. These tend to show up after your glucose has been high for a long time. Yeast infections. Both men and women with diabetes can get these. Yeast feeds on glucose, so having plenty around makes it thrive. Infections can grow in any warm, moist fold of skin, including between fingers and toes, under breasts, in or around sex organs, slow-healing sores or cuts. Over time, high blood sugar can affect your blood flow and cause nerve damage that makes it hard for your body to heal wounds. Pain or numbness in your feet or legs. This is another result of nerve damage. Related, uncommon diabetes. Types, symptoms and treatment. Symptoms of type 1 diabetes. You might notice unplanned weight loss. If your body can't get energy from your food, it will start burning muscle and fat for energy instead. You may lose weight even though you haven't changed how you eat. See which foods are high in trans fatty acids. Nausea and vomiting. When your body resorts to burning fat, it makes ketones. These can build up in your blood to dangerous levels, a possibly life-threatening condition called diabetic ketoacidosis. Ketones can make you feel sick to your stomach. Symptoms of gestational diabetes. High blood sugar during pregnancy usually has no symptoms. You might feel a little thirstier than normal or have to pee more often. Warning signs of diabetes. Complications. Signs of type 2 diabetes complications may include slow-healing sores or cuts, itchy skin, usually around the vaginal or groin area, frequent yeast infections, recent weight gain velvety, dark skin changes of the neck, armpit, and groin called acanthosis nigricans, numbness and tingling of the hands and feet, decreased vision, impotence or erectile dysfunction, ED. Learn about what you can do to lower your risk of diabetes complications. Hypoglycemia. Hypoglycemia, or low blood sugar, happens when the level of sugar or glucose in your blood drops too low to fuel the body. You might feel shaky, nervous, or anxious, sweaty, chilly, or clammy, cranky or impatient, confused, lightheaded or dizzy, hungry, sleepy, weak, tingly or numb in your lips, tongue, or cheeks. You might notice fast heartbeat, pale skin, blurred vision, headache, nightmares, or crying when you sleep, coordination problems. Seizures. Hyperglycemia. Hyperglycemia, or high blood sugar, causes many of the warning signs of diabetes listed above, including heavy thirst, blurry vision, peeing a lot, more hunger, numb or tingling feet, fatigue, sugar in your urine, weight loss, vaginal and skin infections, slow healing cuts and sores, blood glucose over 180 milligrams per deciliter, mg/dl, diabetic coma. Its official name is hyperosmolar hyperglycemic noncatotic syndrome, HHNS. This serious complication can lead to diabetic coma and even death with either type of diabetes, though it's more common in type 2. It happens when your blood sugar gets too high and your body gets severely dehydrated. Symptoms include blood sugar over 600 mg dl dry, parched mouth, extreme thirst, warm, dry skin that doesn't sweat, high fever, over 101 F, sleepiness or confusion, vision loss, hallucinations, weakness on one side of your body. Related, how to prevent damaging your kidneys. When to call your doctor. If you're older than 45 or have other risks for diabetes, it's important to get tested. When you spot the condition early, you can avoid nerve damage, heart trouble, and other complications.